So much emphasis is put on the soundness of a horse and how their capability to perform relates to their legs and different parts of the equine anatomy. While paying attention to those things is extremely important, one of the most essential and sometimes overlooked parts to maintaining your horse's health is with routine dental care. We checked in with Dr. Christopher Baldt to get some interesting facts about equine teeth and why oral examinations and care is so crucial.
Today we're gonna take a look at Artie, the retired standardbred's teeth. So when we talk about the anatomy of the teeth of a horse, we know that they have between 36 and 44 teeth, okay? A horse's tooth never stops growing for its entire life. At humans, we have baby teeth, they get replaced with adult teeth. Those adult teeth stop growing at a certain point, but horses' teeth grow about 3 to 5 millimeters on a consistent basis. So it's very important that we have good dental care for horses. And what I mean by dental care is not just a floating and a filing of the teeth, but they have to do what's called an oral examination. So oftentimes people will come and they just feel the teeth in the back, because as the horse bites, it uses like a figure-8 movement to grind and to crush. So oftentimes on the edges of the bone, of the teeth, they get these points or these sharp marks, and they begin to irritate. The teeth that grow along the cheek grow the fastest. So what oftentimes will happen is, if they're not cared for on a regular basis, putting a bit in the mouth can cause discomfort. So as the equine dentist takes a look at the horse's mouth, they want to see if there's any chips, broken teeth, if there's uneven wearing. I look for, when I'm dealing with a horse a lot, are problems with the movement of the jaw. There's a joint called the temporomandibular joint, which is where the jaw attaches to the skull. And oftentimes there's a locking or a fixation, which can affect the way the horse can grab onto the bit and can affect a performance or actually control. So when we take a look at a horse, we want to make sure that there's good oral health. Horses do get cancer in their mouths. Horses do have issues that are associated with their dental care. So we want to make sure that they have all of their teeth. We suggest that an adult horse gets a checkup at least once a year. And I mean a full oral evaluation, not just poke around with your fingers. And younger horses up to a year or two should get at least twice a year for an oral evaluation. That way we can make sure they're on the right road. Just like when we were children, we'd go to the dentist frequently to set the stage for good health. Wolf teeth, which are small teeth that will form between the two sets, the front and the back set, they should be removed early on to allow for better bit seating within the horse's mouth itself. If they are still not outside of the gum line and the horse bites down, you can have all kinds of problems. I've seen bucking problems, I've seen behavior problems, I've seen head turning, head tossing and things like that, and it causes all kinds of trouble. So just like a human, good oral health is important for a few functions, not only for a nice horsey smile, but also for the digestion of the food. Primary digestion with horses begins in the mouth as they grind their food up and the saliva mixes with it. It starts the chemical reactions to break down the food. So food that's properly ground down will slide through the esophagus, which, if it's done right, you'll avoid the likelihood of choke. And as it goes into the stomach and into the intestines, it's at the proper degree of grinding and into like a paste material, so it's easier to process. So horses have to be maintain their mouth is one of the most important things. Bad mouth, bad feet, no racehorse.
Thanks, Dr. Baldt, for another insightful, educational equine segment. To see more Dr. Baldt features, you can check out our YouTube channel at youtube.com/posttime show. And of course, you can reach out to Dr. Baldt directly by logging on to his website at whereelse? drbaldt.com.